Why should we universally ask women about their alcohol and drug use? Universal screening is not based on socioeconomic status, ethnicity, age, education, or career. It is free from bias regardless of what you see, so it is just like you asking about your patient's prenatal vitamin use or asking to take her blood pressure. It is important to normalize the conversation and be non-judgmental. If all prenatal healthcare practitioners ask these questions consistently, it will seem more routine. Educating the client and assessing the client's risk are two very important steps in universal screening. When assessing the client's risk, you are not looking to see whether a woman is dependent, but to see if she is using alcohol, tobacco, or other drugs during pregnancy.
We recommend routine and universal screening. By that I mean that every woman is asked the same screening questions at the same point in her prenatal care. When providers use routine and universal screening, we know that every woman, regardless of her class or poverty or cultural background, will be asked the same questions.
The 5 Ps was adapted by the Massachusetts Institute for Health and Recovery in 1999 from Dr. Hope Ewing's 4 Ps, released in 1990. The 5 Ps is an effective tool of engagement for use with pregnant women who may use alcohol or drugs. The screening tool poses questions related to substance use by a woman's parents, her peers, her partner, during her pregnancy, and in her past. The non-confrontational questions elicit genuine responses that can be useful in evaluating the need for a more complete assessment and possible treatment for substance abuse. Advise the client that the responses she provides are confidential. A single yes to any of these questions suggests further assessment. The 5 Ps poses questions regarding people in important relationships with your patient. The 5 Ps begins with a less threatening question about smoking and then progresses to questions about someone else's alcohol or drug use: parents, peers, partner. Each subsequent question brings the issue of alcohol or drug use closer to your patient before asking about her own alcohol or drug use.
The best way for doctors and other medical staff to talk about alcohol and drugs with their patients is in a non-judgmental, non-threatening manner. Women want to do what's best for themselves and their unborn child. And so by asking questions in a casual way, we'll open up the chance for this conversation to be normalized. So it's just like asking about diet, exercise, seatbelts, alcohol, drugs, and cigarette use.
Any yes answer is indicative of a positive screen. A positive screen is an opportunity to conduct a brief intervention. Women's health can be affected by emotional problems, alcohol, tobacco, other drug use, and violence. Women's health is also affected when those same problems are present in people close to us.
Women's health can be affected by emotional problems, alcohol, tobacco, or other drug use and violence. Women's health is also affected when people close to a woman are using those things, so we screen all pregnant women for these problems. Have you smoked any cigarettes in the past 3 months?
No.
Did any of your parents have a problem with alcohol or other drug use?
No.
Does your partner have a problem with alcohol or other drug use?
No.
In the past month, have you drunk any alcohol?
No.
In the past month, have you used any drugs?
No.
It is important that you assess your patient to be alcohol and drug-free during her prenatal visit. As a prenatal healthcare practitioner, please ensure the confidentiality of her responses. Always ask the questions in a clear and consistent fashion. The important components of screening and brief intervention are to ask the 5 P screening questions, assess for actual substance use utilizing open-ended questions, advise patient of the importance of abstinence, and monitor use and progress toward abstinence. These steps are important to ensure your patient is receiving the care needed for a healthy pregnancy. You would use a brief intervention for any positive or yes response during the screening process. A brief intervention does not require an alcohol-trained counselor, and it can be done in the office setting. Brief interventions are an effective, low-cost treatment alternative for alcohol problems that use time-limited, self-help, and preventative strategies. Brief interventions have been shown to be more effective than no intervention, and as effective as extensive intervention. The focus will be your patients who are light or moderate alcohol drinkers. The 4 components of a brief intervention are to state your concern, provide an explicit recommendation for change, discuss patient's reaction, review options available, and develop a plan on how to best cease use of alcohol, tobacco, and other drugs during pregnancy. This flowchart illustrates how to approach a negative or positive screening. Assess the situation by asking questions to find out if your patient's alcohol, tobacco, or other drug use is a problem, and to determine the patient's openness to change. We start out by assessing the quantity and frequency of use, if any. You want to find out if there is a current problem and how severe it is. It is also important to assess the negative effects of use. Ask your patient what life or social problems she has experienced due to alcohol or drug use. Evaluate your patient's physiologic dependence. Ask her if alcohol or drug use is affecting her physical life. For example, you might ask, "How do you feel? Do you ever have trouble sleeping? Do you feel anxious or shaky? Do you have nausea, vomiting, diarrhea, stomach cramps, or palpitations other than morning sickness? Do you find that you are using more alcohol or drugs to get the same effect?" When assessing for loss of control, ask your patient questions such as, "Have you ever tried to cut down or stop using? Were you successful? Why or why not? Do you ever drink more than you plan to drink? How has drinking affected your job or your driving?" When determining your patient's motivation to change, you can invite your patient to define her pregnancy goals and plans. Based on her responses, her motivation to change will become apparent and will provide you with an appropriate strategy. It is important to understand the different categories of alcohol use in your patients. Among your patients, you will have about a quarter who report as consuming no alcohol at all or less than 1 drink per month. But remember that no amount of drinking is safe during pregnancy. About half of your patients will be low-risk drinkers who may consume 1 to 2 standard drinks per day, 3 or fewer times per week. Most of these patients will be able to cease alcohol use with a brief intervention and follow-up. The problem use and dependent patients will also need a brief intervention and follow-up from you, but additionally will need to be referred to treatment. It is imperative that you, as their prenatal healthcare practitioner, follow their progress throughout treatment. When you state your medical concern, be specific about risks to your patient and her baby with continued alcohol, tobacco, and other drug use. When advising your patient, do so in a direct, clear manner, using the universal message. Observe her reaction and work with your patient to determine a realistic plan of action. Review treatment options if needed with your patient. Always remember to provide a brief intervention during each trimester because openness to change may increase as a relationship is built with the patient. The screening of all pregnant women and the subsequent attention to substance abuse during pregnancy is one area of your practice in which patient health can be improved and costs can be reduced. Your early identification can achieve a reduction in prenatal drug and alcohol use and the assurance of a better outcome for mother and baby. It is important to avoid strategies that have been shown to be ineffective and can sacrifice a patient's rapport with her prenatal healthcare practitioner. If your patient is showing signs of ambivalence, understand that is a normal step in the process of change. You can use this to your advantage as it opens up an opportunity for reflection and discussion. A directive from you is necessary to assist the patient with cessation. Research has shown that about 87% of women required 1 brief intervention to abstain from alcohol, tobacco, and other drug use. Screening at every visit will increase your patient's comfort level and build trust in your relationship. A patient-centered approach is valuable in empowering your patients to see themselves as capable of making positive changes. Open-ended questions can be a valuable tool to evoke self-motivational statements and intentions to change.